I'm Steve Adubato. This is State of Affairs coming to you from the NJTV studio in Newark. It is our honor to introduce Dr. Shereef Elnahal, President and CEO of University Hospital. Good to see you.
Thanks for having me, Steve.
The former Commissioner of Health in the state. How different is this job?
It's different, but there's a lot of the same focus on public health issues. One way that it's different is that I'm actually running an organization that has such an important, storied history here in Newark. The hospital really promised tremendous things to the community here. There's a history of displaced communities, broken promises, particularly to the African-American community here in Newark. The hospital was part of that bargain after the Newark Accords to do something about that. And so there's a lot more community work that I do to help fulfill that promise. But I'm also focused on a lot of public health issues that I was focused on as commissioner.
Top two?
I would say the HIV/AIDS epidemic in Newark is top of mind. And also just chronic disease and how much that's affecting residents throughout Newark.
You've also talked a lot about the opioid crisis. You've written about it.
I have.
You said we need to do more. Be more specific.
So hospitals in particular have an important role to play. And my involvement in this started when I was in the state. Governor Murphy really pushed us to do everything we can for the epidemic. And so one of the initiatives was reducing overprescribing of opioids. We took best practices from across the state and tried to scale them. That is a funded program now. University Hospital has its own version of that program called STOMP. Stomp out opioids and treat addiction. So what we're doing is having every single pathway possible for our emergency room physicians to prescribe things besides opioids and connecting our patients to as many alternative treatments for pain as possible. The goal is not only to avoid opioids, but to be successful in treating pain, because if you're not successful, somebody's going to go elsewhere just to get opioids. So we've had some great success with that, 70% reduction over just a few years in opioid prescribing.
Give me another topic that you care deeply about.
I really care about doing a lot more for population health in Newark.
You know, the term population health is thrown around a lot. Define it.
It is going above and beyond outside the traditional walls of the healthcare system to do what you need to do to make patients better. If that means doing things like helping them replace their carpet, which is causing their child to go to the emergency room for asthma, with tile, or if that means taking a homeless person and housing them, that is what population health is about, because the root causes that make people come to the hospital are very far upstream in terms of the difficulties they face in life. And unless we start to address those issues in Newark, we're really not going to make progress for our hospital.
So it's interesting, you know, you have a short-term, medium-term, excuse me, and a long-term plan. Are these the kinds of issues that are at the top of the agenda for you as the leader at university?
Absolutely, and we really have to be thinking in all three time phases. There are a lot of short-term problems that we have to address at University Hospital. I'm optimistic because the staff is from the community. They have the skills, they have the talent, they haven't had supportive leadership at my level to encourage them to do better. So we're talking about improvements in quality, we're talking about improvements financially to sustain the hospital, and we have to make sure we maintain regulatory compliance. I'm focused on those three things.
Where does vaping fit into this?
Unfortunately, hospitals across the state are seeing more and more vaping-related illness. We always knew that vaping was risky, but in recent months and years, there's been the addition of chemicals that are involved in flavoring, and most recently, the CDC identified a chemical called vitamin E acetate.
Vitamin E acetate, go ahead.
Yeah, that seems to be the root cause of so many young people having to go to the emergency room and be admitted to the hospital for severe lung illness from vaping. So we've seen our fair share of people with vaping-related problems, and it's a public health issue that we really need to address head-on.
I'm curious about this. Because you have a clinical background, right? Are you able to talk to your fellow clinicians in a different way?
It helps. I would say it's not necessary to be a leader in public health or in a hospital, but you're able to relate on a different plane, especially with the physicians and the clinicians, the nurses, because of personal experience that I've had seeing patients. So it definitely helps.
Curious about this. University Hospital has a long history. We should also disclose in the past, the university has been a supporter of the programming, excuse me, health-related programming we're involved in. But curious about this. Because university has been under a microscope for a long time on the state end. By the way, explain the connection between the state and University Hospital.
So University Hospital is something called an instrumentality of the state. It's
A
the
what?
Only, an instrumentality. It's the only
No jargon here. But go ahead.
only kind of thing that's called an instrumentality. We are part of the state, but we are independently responsible for our financial future. So we have to make sure we support the hospital with our operations, the way we treat patients and volume of patients that we see. We do get support from the state, of course, for charity care. We have the highest charity care population.
Explain to folks who don't know what charity care is and why it matters.
And it really matters these days because more and more people actually are losing health insurance in the context of what's happening in Washington. So anyone without health insurance, including Medicaid, can potentially qualify for charity care, where the state ends up subsidizing your care a couple of years later. We have to file those claims with the state, so the state supports.
Because no one can get turned away from the emergency room, correct?
We have a mission at University Hospital that we never turn anybody away, regardless of ability to pay, regardless of documentation status in the United States. We are there for everybody. And that's why we have the largest percentage of patients in the entire state who are charity care patients.
But in that context, where I was going with the bigger picture question is this: how challenging is it for you and your team at university to deal with reputation? Meaning, if someone reads certain media reports, a certain hospital scores a certain way on a particular grading system, and there's so many out there, but the perception is that university is an urban hospital, trauma hospital. I don't want to get into a branding question, but how much of it is not just what you do, but how you present what you do to the larger community?
It's a really important role that I have, Steve. So the different metrics and the different grading systems don't necessarily capture what University Hospital does.
Methodology is a funny thing.
It is. We are the level 1 trauma center for the region.
Explain that.
We take the most severe trauma in the region, and that comes to our hospital. We have the expertise, we have the surgeons, we have the infrastructure to be able to treat the most severe injury, whether it's a car accident or an episode of violence in the city. We are there for the city. We are also the main academic medical center for Rutgers, New Jersey Medical School. And so we have some of the top-notch academic physicians in the entire country doing research and treating patients for complex conditions. So these are the things that are often missed if you just sort of focus on some of the public grading systems that don't necessarily reflect our safety net mission for the community here, but also our academic mission.
I've asked you this before, I'm going to do it again. You chose to go into healthcare, you chose to go into medicine. Because?
I grew up as a diabetic, and I understood what it was like to be a patient going through difficulty. And by the way, I didn't have anywhere near the social determinant problems, the life issues that people face every day.
Social determinants of your health.
Of health, yeah.
Go ahead.
I was fortunate enough to grow up in a suburban community. Both of my parents were physicians, and I still struggled with my diabetes. So what really made me want to go into medicine was my time in Baltimore when I was actually a counselor for newly diagnosed diabetes patients. And it was an inner city environment, and a lot of folks had difficulty. And I started to see that the folks that were impacted the most wasn't from their disease, it was from their social issues at home. So the lack of a home in some cases.
Poverty.
The poverty itself.
Hunger.
And so to not be able to address those issues is a big oversight, which is really what made me want to go not only into medicine, but into public health and healthcare more largely.
Well said. Dr. Shereef Elnahal, President and CEO of University Hospital, right here in Newark, New Jersey, just a few miles from where we're taping. Thank you for joining us, Doctor.
Thank you, Steve.
Got it. I'm Steve Adubato. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by PSC&G, the law firm of Gibbons, P.C., MD Advantage Insurance Company of New Jersey, Wells Fargo, Johnson & Johnson, NJM Insurance Group, Community Food Bank of New Jersey, Fedway Associates, and by ADP. Promotional support provided by NJ Advance Media, and by Tap Into TV.